A deadly Ebola outbreak is spreading in a remote region of the Democratic Republic of the Congo. Health officials are racing to contain it as resources remain stretched thin. The DRC's Ministry of Public Health confirmed an outbreak of Ebola virus earlier this month in Kasai Province, specifically in the Bulape and Mweka health zones. As of September 15th, 81 cases have been confirmed, including 28 deaths, 4 of them healthcare workers. The region is isolated with poor road access and few transportation options. That makes it difficult for emergency responders to reach affected areas, but may also help slow the spread of the virus to major cities or neighboring countries like Uganda. The World Health Organization says the outbreak poses a high risk at the national level, moderate risk regionally, and low risk globally. Officials also stress that the risk to the other regions of Africa and the world remains low, with no current cases reported outside of the DRC. Ebola is a rare but often deadly illness with symptoms that begin suddenly, usually with fever, fatigue, and sore throat, followed by vomiting, diarrhea, and in severe cases, internal bleeding. The virus spreads through direct contact with bodily fluids and has a fatality rate of about 50%. Genetic analysis confirms this outbreak likely came from an animal to human spillover, not a continuation of previous epidemics. This is DRC's 16th recorded Ebola outbreak since the virus was first discovered in 1976 in a village near the Ebola River in Zaire, now Democratic Republic of the Congo, and Sudan, now South Sudan. Fruit bats are thought to be the natural host of the virus. Humans may become infected after contact with animals such as bats, chimpanzees, antelopes, or porcupines. Ebola mainly spreads through direct contact with blood or other body fluids. It can take between 2 to 21 days for symptoms to appear. To contain the outbreak, health authorities, supported by World Health Organization and partners, have launched a ring vaccination campaign. The Ebola vaccine is being administered to frontline health workers and people who have come into contact with confirmed cases. An additional 45,000 doses have been approved for shipment. The drug MAB-114, a monoclonal antibody treatment, is also being deployed to local clinics to help treat infected patients. Complicating the response are several overlapping crises in Democratic Republic of Congo, including outbreaks of cholera, measles, and mpox, as well as ongoing political and economic instability. Kasai Province borders Angola, and although the outbreak is centered in a rural district, frequent population movements raises concern for wider spread. Officials say the source of the outbreak is still under investigation, and community transmission cannot yet be ruled out. Health teams continue their work in extremely challenging conditions. For now, the international community is watching closely, but global health agencies stress that early action may help prevent a larger crisis. Isaac Akugizibwe, STN News.